Hey there, Dimitri from Total Physical Therapy with Lauren here. Last time we talked about checking the mobility of the anterior hip and how it relates to seeing if the hip is tight by looking at how it drops off the side of the table. Cue last video for specifics. Here, what I want to talk about specifically is the anterior capsule. Not a lot of folks do any type of specific work on the anterior capsule themselves, and we're going to talk about that next time. For now, what I want to do is just show you a simple test, again, that you can do in theory yourself to look at exactly what kind of hip mobility you have in terms of not the muscles, but the joint itself. Can that joint rotate externally, where the anterior capsule elongates? And that's really a very important mobility aspect of that hip. And there are a lot of pathologies and things that can go wrong if that capsule is tight. So a simple test is if you have someone lying on your stomach, bend the knee to 90 degrees, and ideally if I don't block the pelvis, everyone can very easily go all the way down and all the way up, and that's not going to be a problem. But you can see that hip moves. So to find out true mobility of that hip, you want to block the pelvis and slowly rotate to see how far this goes. Okay? So Mike, coming over here. And if you rotate, as you can see, this side goes about yay far. Okay? So again, I'm not allowing that hip to pop up. You want to block the hip and rotate until it kind of gets blocked. So that's in general. And that's fairly good. Mobility of that anterior capsule. So again, the capsule gets short when you go this way in the front, and it opens up as you rotate externally from below. All right. Now, this one we know has a little bit of restriction, and you're going to be able to see the difference. So if I block here and allow the hip to go down, that's about as far as it goes. All right. So we know on her right side, the anterior capsule of that hip does not have the appropriate mobility. And we know that that's something that we need to work on. All right, so again, very easy test that you can do on yourself as long as you have someone that can block the pelvis and prevent it from rotating. And again, if I don't block properly, watch what happens to that hip. Okay, it goes all the way up, and that's not really a true test. You want to block, rotate, and then boom, there's a restriction. All right, so try that. Any questions, total-pt.com. Give us a buzz. And next time we'll talk about specific stretches that you can do to increase that mobility. See you next time.